In this video, we are going to talk about how to lower high uric acid naturally. So your uric acid can become high either in two ways. Either your body is producing too much uric acid or your body is not getting rid of uric acid. So 90% of the times the problem is with excretion rather than generation. And 2/3 of the excretion of uric acid is done by your kidneys and 1/3 by your GIT, that is gastrointestinal tract. And rest of the times the problem is with increased generation, 10%. And here you have to keep your liver healthy, this thing. And here you have to keep your kidneys and GIT healthy so that you do not suffer from high uric acid. Now, first and foremost thing that you have to is hydration. This is extremely important. You must drink around 3 liters of water per day, and you must avoid dehydration at all cost. So people who do strenuous muscle exercise and sweat profusely, or if you take sauna bath and if you sweat too much, you are at risk of dehydration and thereby increase in uric acid. So you have to rehydrate yourself properly. This is very, very important. This is number one step in getting rid of high uric acid. Next important thing is losing the visceral fat obesity and maintaining a healthy body weight. This is equally important because if you have too much body fat, it affects your excretory system and it affects certain transporter of uric acid, and there is increase in the reabsorption of uric acid in your GIT and decrease in the excretion through your kidneys. So it is very important that you lose body fat percentage. You have to correct hyperinsulinemia. If your body has too much of insulin or if you suffer from insulin resistance, you are more at risk of developing high uric acid. This thing, that is hyperinsulinemia, it affects urate-1 transporter, and there is increased influx of uric acid inside your body and increase in the reabsorption and decreased excretion through kidneys, and as a result of that your uric acid can increase if you have hyperinsulinemia or insulin resistance. But the thing here is people should also not follow ketogenic diet. It is a big no if you do not want to suffer from high uric acid. Ketosis will actually increase the risk of high uric acid because when you are in a state of ketosis, what happens that your urine has ketones and your uric acid is also getting excreted through urine. So there is competitive inhibition of uric acid by ketones, and as a result of that, uric acid gets reabsorbed into the circulation and increase your chances of suffering from high uric acid. Ketosis is also going to affect urate-1 transporter and cause an increase in the influx of uric acid. So you do not want to do a ketogenic diet if you do not want to suffer from high uric acid. This is very, very important. Then you have to do moderate exercise and not strenuous muscle exercise, because strenuous muscle exercise will cause increase in the degradation of adenine nucleotide and increased production of lactate. And as a result of that, there will be increase in the generation of uric acid. Also, alcohol does the same thing here. Alcohol will also cause increase in lactate and increased generation of uric acid. And from the nutritional aspect, what is the missing nutrient when your lactate level is high is vitamin B1. So B1 is crucial in preventing lactic acidosis. B1 is very, very important, as well as avoiding strenuous muscle exercise and avoiding alcohol, especially beer. Then you have to avoid fructose. So fructose is the only sugar that is going to cause high uric acid because it is getting metabolized in your liver. And what basically fructose does is it causes depletion of ATP, and there are certain chemical reactions as a result of that which take place, and that results in increased production of uric acid. So fructose is a big, big no if you do not want to suffer from high uric acid. But it is not that you should completely avoid eating fruits. fructose in isolated form is bad, but fruit in moderation is not bad because of fiber. So fiber is important because it inhibits reabsorption of purine and adenine in your GIT. That is why there is difference when you eat fruit and when you drink fruit juice. So when you remove fiber, it completely changes how it's going to be metabolized inside your body. So it's very important that you avoid table sugar, high fructose corn syrup, processed food, but you can add a moderate amount of fruit. I'm not asking you to eat too much fruit, but moderate amount of fruit is actually beneficial for you. Then what you have to do is, there are certain diet advocates who tell you to not eat any type of salt, no salt diet. And that's actually very, very bad for you because this can result in hyponatremia, less amount of sodium inside your blood. And hyponatremia, what it does is it can increase the risk of high uric acid. So you do not want no salt diet. You want to add salt to your diet. It's more about sodium to potassium ratio. So you should eat a lot of vegetables because that's going to have an alkalinizing effect on your urine. And an alkalinizing effect on your urine is also going to prevent high uric acid in your serum. So it's very, very important. Then what you have to do is you have to consume low-fat milk because milk has orotic acid and casein. So casein is a natural uricosuric agent. That means it increases the excretion of uric acid through kidneys, and your body is able to get rid of high uric acid efficiently. Keep in mind that the rate of excretion of uric acid depends on your urine flow, and that's why hydration is very important, and improving the GFR is also very important. Milk also has orotic acid and casein. So orotic acid is going to inhibit the reabsorption of uric acid in your GIT and increase the excretion through kidneys. So milk is actually good for you. And when I'm talking about milk, it's not about the vegan milk, soy's milk, or any type of artificially created milk. Soy's milk is actually bad for you because it has been shown to increase the incidence of high uric acid. So you do not want such type of vegan nightmares in your diet. Next important thing is drinking coffee but without sugar because it has chlorogenic acid, which is a natural inhibitor of xanthine oxidase. And xanthine oxidase, if it gets inhibited, there will be less amount of uric acid. It's also going to correct diet-induced insulin resistance. And we know that insulin resistance can cause increased generation of uric acid as well as decreased excretion of uric acid. So by two mechanisms, it's going to lower your high uric acid, chlorogenic acid, coffee. Then you have to improve your GFR, and for that, vitamin C is very, very helpful. 500 milligram per day for 2 months. Then you have to limit high purine diet. So organ meat, seafood, red meat, all those things, you have to limit the consumption. But this comes at the bottom because it's more about improving the excretion rather than limiting the consumption of purine-rich diet. Of course, I'm not asking you to eat too much of seafood or red meat or organ meat, but definitely the strategy should be from hydration, and then you should try to limit purine-rich diet. Then you have to manage stress. And this is based on one study where they saw a decline in high uric acid when the patient was given diazepam. So stress actually negatively affects the functioning of your internal organs, kidneys, liver, GIT. And it makes sense that if you are stressed, your organs' optimal function will not be there. And as a result of that, you can suffer from high uric acid. So you have to manage stress and have a positive attitude. Then these are the three things that are very beneficial for you: lemon, cherry, cucumber. So these are going to be very, very beneficial for you if you have high uric acid because of their uricosuric properties. And last but not the least, quercetin as a supplement. You can take it to get rid of high uric acid, especially if your uric acid is around 8.